So mechanism of drug absorption. How drug will permeate through skin, or how the semi-solid dosage form permeate through the topical during topical administration. So before understanding the mechanism of drug absorption, we need to know the anatomy of skin. Then only we will understand how the drug permeates through each layers of the skin. So first we will study about skin anatomy. Semi-solid dosage forms are generally used for topical administration of drugs. To understand the mechanism of drug penetration, the anatomy of skin should be known. The skin is made up of several layers, include stratum corneum, viable epidermis, dermis, and it contains appendages that include sweat glands, sebaceous glands, and hair follicles. So these are the layers of skin. The stratum corneum is the outermost desquamating horny layer of skin, means that peeling off layer, comprising about 15 to 20 rows of flat, partially desiccated, dead, keratinized epidermal cells. Semi-solid dosage forms for dermatological drug therapy are intended to produce desired therapeutic action at specific sites in the epidermal tissue. So it just explains about the different types of layers, different layers of the skin. So, semi-solid dosage forms for dermatological drug therapy are intended to produce desired therapeutic action at specific site in the epidermal tissue. So, semi-solid dosage form means ointments, paste, creams, gels. They are the semi-solid dosage form. They are dermatological drug. Dermatological means applying on the skin. They will give therapeutic action on the epidermal tissue. So, this figure represents the anatomy of skin. A drug's ability to penetrate the skin epidermis, dermis, and subcutaneous fat layers depend on the property of the drug, carrier base, and skin condition. So, drug's property, that is a physicochemical property of the drug. Skin condition, we already learned in the factors. Skin condition, if the skin is very tender like children's skin, the rate of absorption will be more, and the base which the medicament is mixed. So these are the factors. So depend on these factors, the rate of penetration or the ability of the drug to penetrate through the skin varies. When a drug system is applied topically, the drug diffuses out to its vehicle onto the surface tissue of the skin. So when a drug system applied topically, when we apply a cream or semi-solid dosage form topically, means on the skin, the drug diffuses out of its vehicle, means drug will be mixed with its vehicle. So drug will come out of the vehicle to the surface tissue of the skin, means the drug will come in contact with the skin. There are three potential portals of entry. One is follicular region, second is sweat glands, and third one is unbroken stratum corneum between these appendages. So these are the entry portals or the entry route of the drugs. Absorption by the transdermal route, penetration is fairly rapid. So through transdermal route, penetration is rapid, but compared to intestinal tract absorption, that is for solid dosage form, it is slow, and is almost always accompanied by some degree of pilosebaceous. So what is pilosebaceous? It's been explained in the bracket. Next is mechanism of drug absorption. Generally, the mechanism of drug absorption is explained by Fick's law of diffusion. Fick's law is dA by dt is equal to d into delta C into K by H.
So where dA by dt is a steady state flux across stratum corneum. So we already know stratum corneum is one of the layer of the skin. So dA by dt is a steady state flux, means the movement of drugs across the stratum corneum. D, diffusion constant or diffusivity of the drug molecules. Delta C, that is a concentration gradient across the stratum corneum, means the amount of drug, the concentration of the drug. K is the partition coefficient of the drug between skin and formulation medium. H is the thickness of the stratum corneum. And diffusion through the horny layer, means the drug diffuses through the horny layer, is a passive process. So it's a passive transport. Passive process means it does not require energy or extra energy for the process. It will be depending upon the concentration of the drug, concentration gradient. The passive process is affected only by the substance being absorbed by the medium in which the substance is dispersed and by ambient condition. So, the passive process is affected only by the substance being absorbed by the medium in which the substance is dispersed and which will be carried out in an ambient condition. Means temperature, pH should be ambient. Ambient means what? Favorable condition. Okay. Then next paragraph it explains how the transport of lipophilic drug and hydrophilic drug. When we compare lipophilic and hydrophilic, the rate of transport or the permeation will be more for lipophilic drugs because the area through which the hydrophilic molecules can permeate is only 1%. Okay, so compared to lipophilic and hydrophilic molecules, the more amount of permeation will be there for lipophilic drug molecules.